moderate today's this evening's session, a portion of the session. And I've been working with the CAG, the Community Advisory Committee, for the last, I guess, about 11 months or so. So I have some familiarity with the project and with some of the players involved, and anxious to get this started tonight. We've identified a few key objectives that we want to share for tonight's session. The first is to provide you with information about the health study, what it is, what the process is, how the community has been engaged, how you can continue to be engaged as well. We also want to answer questions from the community regarding the disaster and the health study. And finally, we want to obtain feedback, questions, comments from you on priorities and other ideas and thoughts on how to shape this health study. So you'll hear a lot tonight about this health study, about all of these different items, and we're really looking forward to the Q&A session that should start at the latest at 7 o'clock. It looks like right now we have about 54 people that are logged in as attendees. I know we have some of our Community Advisory Committee members. We have some public officials that'll get recognized as well. And we have hopefully lots of members of the community. As I noted, we are recording this. So for those that are watching the recording, you may not be here live with us now, but we are thankful that you're watching this on your own time from the website. As you'll hear more tonight, the success of the health study really depends on community participation. Participating tonight is one way for you to get involved, but it's certainly not the only way. On the screen, you see 4 boxes that have other ways to get engaged and stay engaged. Following the health research website, there's also a link to provide feedback and ideas into the study, to see also all the community and feedback and ideas that have been submitted thus far, as well as to sign up for a newsletter that you can receive regular updates. At the bottom of the screen, you also see a link. One exciting thing that's been happening recently is the county hired a third party specializing in statistically valid surveys, and had been developing a survey questionnaire that was developed in part with Community Advisory Committee members. And that's been being delivered by phone and by an online forum to about 400 plus residents, to ensure that we have a statistically valid input. But we are now making that survey live as well to get additional input. So that'll be combined with those submissions that have already been taken into account for that survey. And you'll hear a little bit more about that later on. This slide will be repeated again at the end of the presentation, and all of these slides will be posted on the city or the town hall resources page. On the screen, you see a snapshot of the agenda. We'll spend about approximately the first 20 to 30 minutes going through some logistical housekeeping type items, and then having a few opening remarks as well. That'll be followed by a presentation on the health study, an overview presentation, and also a short presentation focused on the Oversight Committee. That leaves us with at least an hour for question, answer, and comment period. One of the priorities, particularly for DPH, along with the Community Advisory Committee, was to make sure that we had lots of ways for people to interact during this town hall. So we've listed on the screen here 4 ways, and I'll go through them just to make sure everyone is fully aware and has the right resources and knowledge. First, we were asking people to email questions ahead of time. You can also use that function right now. You can email questions to alisostudy@ph.lacounty.gov at any point. You can also ask your question through a moderated call-in number, and I'll show that in just a second as well. You also can type your question directly into the chat box, and I'll show details on that, along with being able to raise your hand in this WebEx meeting to be unmuted and to voice your question. So the toll-free number is on the screen, and that number, you call into that and you dial 1 and then 0, and you can be put into the queue for the Q&A. You can also people are on that line just listening in as well. So if you don't want to share a question or comment, you can just listen through that number. When you do press 1 and 0, the AT&T moderator will ask for your name. You can also inform him that you would rather stay anonymous, so you can do that as well. We are limiting questions to about 90 seconds, just so that we can get through as many as possible. And then the chat function. So along the bottom of the screen, there is a chat button. When you click on that chat button, the chat box will open up. You can type in a comment or a question, and you can do that at any time. You don't have to wait for the comment period. So if you want to post something, you can do that at any time. Click send or press enter, and that will go to the panelist administrative team. You should get a message back that your comment or question was received. And then there's the raised hand function in WebEx to actually voice your question over the system here. And to do that, you click on the participants list. You'll see your name, and then next to your name, there should be a circle with a little hand waving. If you click on that, that raises your hand and will put a little hand icon next to your name. That will enter you into the lineup to ask a question. At the point when it's your turn, the host will unmute you and you'll be able to ask your question. And a timer will pop up with that same 90-second countdown. I should note that the call-in, the 1-800 call-in, has a moderator via AT&T. The WebEx will be myself helping to moderate those callers and those questions. And again, here you can raise your hand at any point in the meeting, and we'll make sure that you get into the lineup for the questions when the question and answer period starts. Just like with the chat, you should receive a note that we see your hand is raised, and we'll put you into the lineup. One thing to note is that the host and the moderators, we can't put your hand down, lower your hand after you've asked your question. So that is something that we'll ask you to do if you can. After you ask your question, click on that hand and it'll lower your hand. You can do the same if you want to. If you change your mind and someone has already asked your question, you can lower the hand at any time as well. So here's just a reminder, these are the 4 ways to ask a question. At the bottom of the screen, you see that yellow bar that has a reminder of those 4 ways. And that yellow bar will now be on all of the slides going forward, so that you'll have a chance to remind yourself how to ask those questions at any point. And before turning it over to Dr. Davis, I actually would like to turn it over to Mr. Jared Degonia, who's going to make a couple comments just to kick us off before turning it over to Dr. Davis. He is the Senior Field Deputy for the 5th District. And I will turn it over to Mr. Degonia.
Good evening, everybody. Can you hear me and can you see me?
Yes, we can hear you.
Thank you very much. First and foremost, I just want to appreciate everybody that's taking time out of this evening to participate in this town hall meeting. And I do want to thank the leadership of our Scientific Oversight Committee, the Community Advisory Group, as well as staff from the respective departments that have been working on the health study. On behalf of Supervisor Barger, we just appreciate everybody's willingness to volunteer their time to this effort. I know there's a lot of questions, and I know there's going to be a lot of details in regards to the subpoena authority on behalf of Supervisor Barger and the board itself. I do want to tell everybody that it is an issue that we are continuously working with the Department of Public Health as well as County Council. I do want to acknowledge that we did receive the message today that was jointly signed by the Oversight Committee as well as the CAG, and that it's not lost on us that email was sent. Having the Scientific Oversight Committee send that message and along with the CAG does offer us a little bit of guidance and how to move forward, seeing as the SOC is mandated as part of the master settlement. So I do want to acknowledge that. I don't want it to be lost on anybody that we had not received it. So with that being said, I just want to simply say thank you again all for your volunteerism. Thank you for your service on behalf of the supervisor and on behalf of the county. Thank you very much.
Great, thank you very much. And now I'd like to introduce Dr. Muntu Davis. Dr. Davis is the executive lead for the Aliso Canyon Disaster Health Research Study. He's also serving as the LA County Health Officer and has been in that role since July of 2018. Prior to that, he was the officer and director for Alameda County Public Health Department. You may have seen Dr. Davis on various webinars and other things recently, because he's also taking a very lead role in the COVID response here in LA County. Dr. Davis is a national advocate on elevating and implementing health equity frameworks within government agencies and received his medical degree from UCLA. He completed the California Endowment Scholars in Health Policy Fellowship and received his Master of Public Health degree from Harvard School of Public Health. And with that, I will turn the floor over to you, Dr. Davis.
Thank you. Appreciate it, Susan. And Jared, thank you very much for providing some comments to open this session. I want to say good evening to everyone, and I'm glad to be here with all of you today. We imagined that this was going to be an in-person meeting, but given the circumstances, we appreciate everyone's participation in this virtual town hall. I'd like to take a moment to thank the members of our Aliso Canyon Disaster Health Research Study Project team, as well as the support team for all the work that went into making this event possible today. I also want to recognize that we have with us Jeremy Saray from the Office of Assemblymember Jesse Gabriel. Thank you for joining us. And I'm not sure if we have others from other state and local leaders on this call today, but do appreciate all of you as well. But most importantly, I'd like to thank the community members who are joining today to hear about the status of the health study. And special thank you to the Community Advisory Group, or commonly known as the CAG, who are members who've been providing input and suggestions to our health study to date. You see them all listed here. They've been instrumental in some of the changes that we've done moving forward, and it has been a collaborative effort, along the way. They represent key interest groups, including schools, environmental health groups or environmental groups, as well as health providers, as well as the areas covered by the 7 neighborhood councils, which include Northridge West, Porter Ranch, Granada Hills North, Northridge East, Granada Hills South, and Chatsworth. If you want to get in touch with the members of the CAG, you can send an email at members@alisohealthstudycag.org, and they will receive that. So to start, I'd like to briefly go over some background on the Aliso Canyon disaster and events that led to the $25 million health study for those who are attending who may not know. But before I do that, I do want to acknowledge that many of you attending today experienced the blowout firsthand and continue to live with the impacts of those days and the loss of loved ones, friends, and pets. Some of you have unanswered questions about the long-term health impacts of the blowout, and many still have questions about the response itself. I wasn't here at that time, but I've spoken with and heard from those on the community advisory group, as well as those who attended some of the early CAG meetings. And my heart goes out to all of you who were and continue to be impacted by this blowout. And while I may not be able to answer all of the questions related to the response, as Susan mentioned, the goals of the day are really to have you informed about the health study in terms of where it is, the status of that, as well as to try to answer questions about the study so that we make sure you understand that, and you all, if you are eligible, and many of you I believe will be, participate in the health study, because your participation is what's needed to really understand what some of the long-term health impacts of the study may be. And then to answer questions about the health study, and hopefully we can get answers to all of your questions, but if we can't, we'll try to get back to you in some other form or fashion. So I do want to talk a little bit, and again, in terms of the background, and a lot of this information is based on what the regulatory authorities have found in terms of the root cause analysis related to the Aliso Canyon blowout. And understand that Aliso Canyon is an oil field and a natural gas storage reservoir, which is owned by the Southern California Gas Company, also known as SoCalGas. One of its depleted oil and gas producing formations, the Sense-9 Frew Zone, was converted into a gas storage reservoir in 1973. The Aliso Canyon disaster was the largest natural gas blowout in U.S. history. It began on October 23rd, 2015, and over the course of 111 days, an estimated 109,000 metric tons of methane and gas constituents escaped uncontrolled from the Southern California Gas Company's Aliso Canyon storage facility, well SS-25. The well was sealed on February 11, 2016, after 7 failed attempts. Well SS-25 is one of about 117 wells that were originally drilled in 1953 and served as an oil producer until about 1973, when the oil well was converted to a gas storage well. An investigation discovered several reasons why the well failed and resulted in a gas blowout. First, related to old infrastructure and the lack of maintenance. First, the tube in which the gas is pumped into and drawn out of the gas reservoir didn't have proper casing along its entire length. As a result, corrosion of the casing led to a rupture from which gas escaped. Risk assessments were not regularly conducted to ensure the well integrity management. Currently, California regulations and SoCalGas, the regulatory authorities over them, and SoCalGas integrity management practices address most, if not all, of the root causes of the blowout to date. Now, the settlement on August 8th, 2018, California Attorney General Becerra, along with the California Air Resources Board, the Los Angeles City Attorney, and the Los Angeles County, secured a $119.5 million settlement with SoCalGas over the disaster. The $119 million included $32.2 million for health programs and $10.1 million for air quality programs. The settlement health programs included a $25 million health program fund for the long-term health study of Aliso Canyon, and $5.2 million for lead hazard cleanup near Exide, and $2 million for the new county breathmobiles. During the Aliso Canyon disaster, our department, in collaboration with several lead agencies and community partners, mounted a response to the incident. Actions were taken while the situation continued to evolve to protect public health. Decisions were made based on information and details from the disaster as they were uncovered or became available. Our department was compelled to take proactive steps at several points in the response, including directing the relocation of residents who were experiencing symptoms from the blowout and relocation of schools impacted by the blowout. We relied heavily or largely on media to communicate the relocation offers. And as with any emergency, there are lessons learned along the way or afterwards, really. And in hindsight, a door-to-door outreach and even targeted social media could have been improved with door-to-door outreach in order to get that message around relocation sites out. This experience has been put into play more recently with multiple community field responses, including the Exide community, where we now utilize this more direct community outreach method to ensure proper and improved methods of communication. But I will say that with any disaster that I've seen or been a part of, communication has always been and led to some lessons learned after the fact that get put into play moving forward. In terms of air sampling and interior cleaning, we initiated an expanded air monitoring program through this effort, continually requested that SoCalGas and its partner agencies expand to more community monitoring locations and more chemical tests. This program was delayed and actually fell short of our guidance and our request. The expanded test and facility source sampling occurred on one occasion in January 2016 and should have been done more frequently. Unfortunately, we as our public health department didn't have authority to order a lot of the tests and some of the response efforts that were needed, but we did the best that we could at the time. We did conduct a rapid health survey that reported evidence of people still getting sick after the well had been capped. And that evidence was used, that was the CASPER study, was used and was essential to providing information that was needed for the long-term health study in which we're embarking on now. And that $25 million settlement is again put forward for that purpose. While we have been allocated these funds, while we had been allocated these funds later than optimal in terms of initiating a health study, we are still committed to ensuring a timely planning and initiation of the health study continues to move forward. There are other areas of the emergency response that in hindsight, could have been improved. For example, we recognize that our department could have communicated to the public more clearly and perhaps more often in terms of the details of what were happening. One example, and I know this has been brought up a lot, which is the Los Angeles County Health Alert Network public notice to inform physicians that toxicological testing would not be helpful for clinical diagnosis. This could have been worded differently to explain that the laboratory test for monitoring compounds such as benzene, these tests are approved for biomonitoring purposes, but not for clinical evaluation. But in either case, that communication didn't lend to the message that I feel was probably best at that time. The disaster, in terms of the residents impacted and the families affected affected the families in many ways. And I think acknowledging the emotional and psychological impacts that it had, would have been much more helpful and could have been better along that way. Recognizing that relocation in terms of moving residents from their homes and communities is not only a stressful process, it also uproots the social networks and support systems and services on which families rely on. And during and following the disaster, there are many unknowns. Ensuring that the public is being provided with accurate and timely information to make informed decisions is crucial. We recognize that we didn't get everything right, and all the response agencies didn't get everything right, and information didn't come out in as timely of a fashion as we could look at in retrospect. And certainly this contributed to the stress of the situation that many of you in the community felt. Many people experience symptoms of unpleasant and distressing symptoms such as nosebleeds, headaches, nausea, shortness of breath, eye and skin irritations. And some of you noted that your pets also were impacted with some of these similar symptoms as well. And we understand and know that, and hopefully as we go through and move forward with the health study, we'll have some better and more quantifiable information in terms of the long-term impacts and the acute impacts that many of you experienced during that time. There's, some uncertainty as we, move forward regarding health symptoms that are still reported today. And we recognize that despite the well-being cap, some residents have reported they're still experiencing, symptoms today. And on occasion, we do receive reports of gas odors from the neighborhoods near Aliso Canyon, the Aliso Canyon gas storage facility as well. And this is just one of the reasons why we need this health study, which can help us understand many of the outlying questions that we simply don't currently have answers to regarding exposure, health symptoms, and long-term health impacts. And so with this background information, I'm honored to introduce Dr. Simon, one of our colleagues, our Chief Science Officer here at the Public Health Department. He's the Director of the Division of Assessment, Planning, and Quality at the Los Angeles County Department of Public Health, and an adjunct professor at the Department of Epidemiology at UCLA Fielding School of Public Health. In his role as Chief Science Officer, he leads the department's efforts to integrate science into public health practice. He's a pediatrician and preventive medicine doc and has extensive experience in epidemiology. Dr. Simon is serving as one of the members of the Scientific Oversight Committee and on the Aliso Canyon Disaster Health Research Study, and has been working to address the needs of community members affected by the Aliso Canyon disaster. We're grateful for his support and are delighted that he could join us today. Please help me welcome Dr. Simon. Dr. Simon, are you there? If you are talking, you are muted.
Thank you. Now, yeah, hopefully you can hear me. So thanks for that welcome, and welcome to everybody who's on this webinar. Like Dr. Davis, I was not directly involved in the response to the Aliso Canyon blowout, though I was here. I was in the department. I was in a different part of the department, but I certainly heard a lot about what was going on. As a resident of Los Angeles, you couldn't help but know about this disaster. Over the last 18 months or so, I've been very involved, both getting to know members of the community advisory group, but also having opportunities to meet many in the community. So I've heard firsthand about the trauma, and I recognize the very significant trauma that folks in the surrounding communities experienced. I recognize and have heard very clearly the frustration. And there are many days where I share your frustration. Above all, I personally, and I know our department wants to get to the bottom of all this and understand why people in the community continue not to feel well. Even if you do feel well now, I think we want to understand what the exposures that occurred, what the implications of those exposures are as we think about the future, certainly the health of our children, but really the health of everybody. So with that, if you could advance to the next slide. I do want to talk a bit about the health study. And first of all, I think I want to just spend a little time talking about what we mean by a health study, because I think it means many different things to different people. But I think one sort of basic underlying principle is that a health study is a scientific inquiry. It's science-based, designed to address one or more defined research questions. So a good study will very clearly define what the question is that it's trying to answer. And when we talk about scientific inquiry, what this implies, very importantly, is exploration and measurement. We're actually measuring things in a rigorous and a systematic and an objective way. Ideally, one enters a study without any preconceived ideas about how it about the results. We do have hypotheses, but I think we always want to go into a study with an open mind and be as objective as possible. Now, there are many different types of health studies. Broadly speaking, for example, we often talk about descriptive studies, where we're simply trying to describe the health status of a population, whether the health is getting better or worse, whether the health of a population is better or worse than other populations. So sort of the characteristics, the health characteristics of that population. Other studies, broadly speaking, are analytic studies where we're actually trying to identify relationships between risk factors or causes and health outcomes. Those are more challenging studies, but clearly in this situation, critically important. We want to understand what may have caused the symptoms people are experiencing, the illnesses people experienced. We want to understand what the implications are for future health risks. In addition, health studies can be divided broadly into epidemiologic studies. In public health, we rely on epidemiology as the basic science to understand the health conditions within a population and the factors that determine health in populations. But in addition, there are clinical studies where there's a focus on patients or individuals where there are actually clinical exams that are done. There are laboratory studies where detailed examinations of biological specimens, blood specimens, urine specimens can be done. I think the bottom line here, though, is that as we all, I think, agree, we're dealing with an incredibly complex disaster, many potential exposures, many chemicals in play, thousands of people impacted, even just within the 5-mile radius, nearly 250,000 people impacted, but people even further out that experienced symptoms. And so I think we have to be very open-minded in terms of what we think of in terms of study design. And I'm very excited about the Scientific Oversight Committee. I think we have some of the best minds and the most experienced people around that can help inform us. But we do want to be informed by the wisdom of the community, the fact that you all lived, and I hate to use this phrase, breathed this experience. There's a wisdom there that I think is important for the scientific oversight community to tap into as we think about how we prioritize the health study, or it may be a number of component health studies moving forward. Next slide, please. So key elements that must be defined in a health study. Number one, as I mentioned, the research question. The more specific it can be, the better. Defining the study population, and this may seem sort of basic, but in my interactions with the community, my sense is that there can be a fair amount of debate about what that study population is. Is it the population just most closely located to the facility 91326 zip code, or do we extend it further out? The further out we go, there are trade-offs in terms of the potential to identify causality, but at the same time, we want to be as inclusive as possible. Study populations sometimes focus on particular groups. It could be children, for example, or seniors, or people with existing health conditions. It doesn't have to be a human population. I've heard loud and clear that people were very concerned, continue to be concerned about their pets. So is that something we want to consider? And then the time frame. Do we just focus on exposures, for example, during the blowout, which initially I thought would be the case, but then as I've spoken to and listened to many community members, I have a clear understanding that the concerns continue to this day, concerns that there may be exposures that are placing the health of nearby residents at risk. And then, excuse me, very importantly, the health outcomes of interest. What I hear often is that people are sick, they're not feeling well. And that's extremely important to know and extremely important to try to study. But to the degree we can try to be more specific about what kinds of symptoms people are dealing with, or if there have been diagnoses, what specific diagnoses have been made or that we think may be in excess based on the exposures that have occurred. And to define the research questions with that level of specificity is very important. And of course, the potential exposures of concern. And as Dr. Davis mentioned, there has been a great deal of concern, appropriately so, in the completeness of information on the chemicals and other substances that people may have been exposed to. But I do want to say it's much more than just receiving a list. Unfortunately, I wish a list would be sufficient, but just a list may not be as helpful as we would like. I think we need to understand the concentrations and the actual emissions that occur. So the most complete information we can get on all of that, I think, will be critically important for the study moving forward. Next, please. So lots of, I do want to emphasize that we're not starting from scratch here. Over the last 18 months, I've read, I think, thousands of pages of reports about this disaster and the response, and pages and pages of results of testing that was done. Certainly not enough. We would like more complete information, more precise information on the chemicals and the levels of exposure. But at the same time, I think we do need to acknowledge that we have lots of information as outlined here on this slide. But in addition, there are efforts underway to test the contents of the bins. Many of you have probably heard about the bins that were identified on the facility site, making sure that those bins and the contents are not discarded before we do all the testing we feel is important to do. Some testing has been done, but in addition, we're seeking input from SOC members, Scientific Oversight Committee members, to make sure we're testing for the right things. But I again want to emphasize that this is not a panacea. Just identifying additional chemicals, if we do identify additional chemicals in those bins, it may give us some additional insights, but alone won't tell us what levels of exposure were during the disaster or afterwards. Next. So the broad goal of the health study is to increase understanding of potential short and long-term health impacts of the 2015 blowout and related storage facility operations then and continuing to the present. But I think very important for everybody to understand that the Scientific Oversight Committee will help identify specific study goals based on input provided from the community, along with their expertise, their knowledge of the scientific literature, and their understanding of what the exposures may have been based on the testing information available. We definitely want to identify study priorities where we think we have the greatest likelihood of identifying causation or at least increased risk. And just again, to underscore, your input will be extremely important. We know there are about 35,000 people that live in that zip code, 91326, but again, 250,000 or more people that were impacted by the disaster. And we're very open to suggestions for how we reach the greatest number of people to gather community input. Next, please. So just briefly, the overall structure. At the center, of course, we have the researchers, and let me emphasize, this is a study that will be done by independent researchers. It will not be done by the Los Angeles County Department of Public Health. That was very clearly spelled out in the settlement agreement. The settlement agreement also requires that there be a scientific oversight committee. You'll hear a bit more about that group in a few minutes. And then, again, very importantly, community participation. We want this to be a community science-driven study. We feel very fortunate to have the knowledge and expertise of the community advisory group members. Frankly, some of the best informed community members I've ever interacted with. Many have an encyclopedic knowledge of the events of the disaster and the responses that occurred afterwards. But we do want to tap into the knowledge and experiences of as many community members as possible. Our role at the top is an oversight role. I don't want to understate that. I mean, I think there is dual oversight. The Scientific Oversight Committee has very important oversight, but the Department of Public Health, as outlined in the settlement agreement, does have administrative oversight. We'll be tracking things, but to the greatest degree possible, I frankly would be happy to pull us out of the middle of this, except in the areas where we can contribute our knowledge and experience. But otherwise, we want this to be an independent study. And again, science-driven and community participatory. Next, please. So what can a health study do? Well, I'll just briefly read down these bullets. They can help provide insights on why some residents were feeling ill and may continue to be feeling ill. On occasion, studies can provide a definitive diagnosis, but I have to say most studies don't necessarily provide a definitive diagnosis for any given single individual, but there's no question that we can learn things from studies that will provide residents and patients and their providers with insights about why people may be suffering. Improving our understanding of possible health outcomes among impacted residents, and in particular, trying to better understand what future health risks may be. Informing actions to better protect the community. Obviously, we want to learn things that will improve our ability to respond in the future, and very importantly, I think, prevent disasters like this from happening in the future. Helping prepare for and respond to future similar emergencies should they occur, as I've mentioned, and influencing future policy changes to prevent similar disasters. We know there are about 400 natural gas storage facilities across the country. About 80% of them are on depleted oil and gas reservoirs. Aliso Canyon, I believe, is the second largest on the West Coast, and also one of the largest in terms of the largest potentially impacted populations. And so we understand that sometimes in public health, certainly, sometimes in the greatest impacts can be made in the world of policy, passing policies, and then more importantly, making sure that policies are enforced. Next, please. So the process, community engagement and outreach, this slide suggests a linear progression, but I don't want that to be the message. Community engagement and outreach is going to continue throughout the process, but it's extremely important at the beginning. And then the phase we're in now, health study scoping, with the community, with advisement of the SOC, answering those questions, or better defining those issues that I mentioned on the earlier slide. What's the study population? What are the research questions? What are the particular health outcomes that should be prioritized? And what are the exposures that should be paid particular attention to in the study? Based on this, the SOC will establish the goals of the study. Based on that, then we will issue a request for proposals to researchers. And those proposals that are received will be reviewed, and then a selection, one or more selections will be made based on evaluation criteria that are established. Next slide, please. So community engagement and outreach, once again, extremely important. We did have an open house shortly after we acquired the funds to do the health study back in early 2019. We've continued to get feedback from the community through a variety of channels. The community advisory group, very important. We've been meeting with them formally about monthly, but we've had many communications with them between meetings. We have an e-newsletter that goes out to local residents. We're open to suggestions on how we can increase the reach of that. We have other information and resources on our Aliso Canyon website. Next, please. And our commitment to the community, one, I think, again, is the community advisory group meeting monthly. We want these meetings to be open to the public. We need to do a much better job of publicizing these meetings. The establishment of the SOC, a diverse group with major independent experts. It was clear, we heard loud and clear that the community did not want this to just be experts from the regulatory government agencies, but that there be independent experts as well. We are, based on input from the community, doing a preliminary cancer investigation. When I say we, it's really the community in collaboration with the USC Cancer Surveillance Program. In addition, we're planning to do an analysis of data on complete blood counts, and also lab data on liver function and kidney function on folks living in zip codes near the facility versus some control communities further away. The public will have an opportunity to provide feedback on the health study goals during a public comment period later this year. The study goals will be made available on the Public Health Research Study website. And moving forward, we are committed to making sure researchers provide updates to the community on study progress and results. I think that's my last slide, but maybe advance it just to be sure. Yeah, so I think I'll turn it back over to Dr. Davis now. Thank you.
Thanks, Dr. Simon. As we go through, I want to just go a little bit over the Scientific Oversight Committee, or only referred to as the SOC. Here you can see the SOC members who, again, are essential to helping to drive what this study looks like in terms of the ultimate goals and the study questions, and then having, again, some oversight, in terms of feedback to the researchers. So as you can see here, we currently have 8 independent experts who are part of the members of the SOC. They're all listed here on the left. And then we have 6 agency representatives as well. They're listed on the right. And you can see the agencies that they're representing. I do want to note here that we do have an independent SOC position, member position that is open. We have gotten some feedback from the SOC members in terms of additional expertise that they feel might be needed to help as they move forward on their goals. And then we'll continue to work through that and fill that again. But that will be, again, an independent scientific expert on the SOC as well. Again, the Scientific Oversight Committee is a requirement of the settlement agreement, specifically with regard to agency membership. So the agency members that you see are part of the settlement. They aren't randomly chosen by us. in terms of the agencies that are represented there. And one of the main responsibilities of the Scientific Oversight Committee is to determine the goals of the health study, in addition to overseeing and providing scientific advice to the future researchers who will be conducting the studies. The SOC's future responsibilities include oversight and guidance, again, to the researchers who will conduct the health study. They'll evaluate whether the health study is on track to meeting its predetermined goals at the end of the third year of the health study. And this evaluation will be repeated every year that follows. The health study period will be a maximum of 10 years. And the SOC has full discretion to determine the merits of continuing the health study based on their evaluation. The SOC has a diverse set of specialties, and as you can see here, in terms of the breakdown, we have air monitoring, we have air modeling, exposure assessment, epidemiologists focused on cancer and oil and gas, as well as mental health and disaster behavioral health specialists, toxicologists, environmental health specialists, and physicians. And the health research next steps include the SOC will meet twice more this year to determine the health study goals. The health study goals will be made available for public comment, as Dr. Simon mentioned, before they are finalized. This is much like many of you have seen when you have a proposal out and there's a comment period, you send in your comments, those are all incorporated and pulled together. We'll do the same thing in relationship to the health study goals. We will, as the Public Health Department, release the request for proposal. Again, this is all based on what the SOC designs in terms of the research goals as well as the research questions. And we'll release that proposal in the spring of 2021. That's our goal. And researchers will submit their proposals in order to be funded for the health study. The health study relies on public feedback. And so, it can't be done without the participation of you all who were part of impacted by this disaster, this blowout. And please be sure to stay up to date on the health study by visiting the Aliso Canyon Health Disaster Research Study website. You can see that here. And you can email us with your thoughts at alisostudy@ph.lacounty.gov. Again, that's alisostudy@ph.lacounty.gov. And now, Susan, I think we can pass it over to you for question and answer.
Yes, thank you, Dr. Davis and Dr. Simon. Just an update on attendees. We are at 88 attendees right now, so it's great growth from when I first announced how many participants we have. Just a reminder, on the bottom of the screen, you see the different ways that you can ask a question. And I know right now that we have, and plus, I'm sorry, we have 88 on the WebEx and 12 on the AT&T call-in line. So we have 100 people. And we do have 2 callers on the AT&T moderated line who are in line to ask a question. So I will turn it over to the moderator to introduce our first questioner.
Thank you. Again, if you would like to ask a question on the telephone, please press 1 then 0. And our first question comes anonymously from the line 18. Line 18, your line is open.
Yeah, hi. I have a question for you there.
If you are calling in and also have your computer on, you might want to mute your computer so you don't get the echo.
Okay, how's that?
Much better.
So yeah, there's a question pertaining to the extent of what we've been exposed to. What has public health done to obtain full disclosure on what is stored in the reservoir, what has been dumped in the reservoir, either legally or illegally, and what are some of the ways the Public Health Department has gone about getting all that information for the public?
Thank you. Appreciate the question. And what I do want to acknowledge is that there are a number of different response agencies and actually some active involvement, with I believe with the Public Utilities Commission and SoCal Gas on obtaining additional information that hasn't been released so far. And then we continue, as the county, we continue to work with our board and our county council in terms of figuring out what additional options we have to get the additional information. We all recognize that that information is needed. And there is, again, an active, I don't know what you call it, a process with, I believe, with the Public Utilities Commission in order to get that answer. And they are actually the regulatory body over this type of facility. So we have to rely on them as well. And then in coordination, try to figure out what else might be done in order to get the information that's needed. I will acknowledge also that we do have and have sampled some of the other material that is still on site that we were made aware of. And we do have additional questions for the Scientific Oversight Committee in terms of any additional tests or things that they may want to see in terms of sampling related to that material, which is from the blowout as well. So it's an active role, but we have a number of different players who are trying to get additional information that might be missing at this time. Thank you. We'll take the next question.
Thank you. And that comes from the line of Daryl Gale. Please go ahead.
Hi. First of all, on the phone, it's really hard to understand Dr. Davis. I don't know if it's because the microphone isn't near him, but it really is hard to hear him. Okay, my question is, so I live in LA, but I've got some dear friends in Porter Ranch and some more dear friends in Playa del Rey. And all these people are having this chronic suffering of breathing in these methane leaks on the gas fields that they live near or on top of. They suffer from the three most common ones, which are the headaches, nosebleeds, and constant nausea. So it's a two-part question is, if you're constantly like low-level sick, wouldn't that make you more susceptible to a virus or a pandemic? I would think that would just weaken your immune system if you're breathing in, methane and toxic gases all the time. And then in the long-term effect, it would just seem like these people were candidates for cancer. So I just want to know if the health study is covering the short-term annoying effects and then the potential long-term effects. Thank you.
So I'm happy to begin. Thank you for that question. Yeah, I think the reality is LA was built over a lot of land that was used for oil and gas development. And so I think there's, a lot of concern. I think the big issue for the city, the county, and the state is how to address populations that are in close proximity to oil and gas operations. In terms of the study, I think there is an interest in studying both acute and chronic health impacts. Right now, I mean, the evidence is crystal clear from Aliso Canyon, that the disaster, that many people experienced acute health impacts. I mean, there's no doubt. Where there seems to be greater questions are, what are the long-term health implications? Now, a number of residents have experienced long-term health complaints and illnesses, and it's our job, I think, in the health study to try to figure out why that is.
Thank you, Dr. Simon. We're going to move over to the raise hand and recognize one of our call-in questions, or our WebEx questions. First, I'll go to Alexandra. If you want to ask your question, you'll be unmuted. And the clock will pop up here to give you a showing of the 90 seconds once you start your question.
Great. Yeah, thank you. Can you hear me? Seems like it.
Very, very quiet. Maybe speak up a little bit.
Okay, 1 second. Okay, hopefully that's better. Yeah, one of my first question is, who will select the research group? If the Department of Public Health is selecting this group, how will we be confident that it was objective and non-biased? I think that's a really critical issue here, is ensuring an independent body do this study. So that's my first question. And then I've been typing up some questions in the chat just for transparency's sake. I'll repeat them quickly. So one is just asserting that the environmental data, specifically the air quality data collected during the blowout, was reviewed by the California Council on Science and Technology, and they pointed out that this was not of the scientific caliber needed to determine long-term health effects. So really emphasizing the need for looking at the people and studying what's going on in their bodies, like what happened in Flint. And also the need to look at the cancer registry data. Not sure how far back this type of data goes, but personally, I've worked with many people in the community for 6+ years and have had residents, stand with me on their sidewalk and point house by house, who's getting cancer in the community, what type of cancer they're getting and when they passed away from it. And this is just, a common story that I hear in working with community members. So this really needs to be addressed. And finally, looking at disclosure of the chemicals, and that's already been emphasized, but not just what chemicals, but in what quantity, because that's critical as well. And looking at all available information, like what the Air Quality Management District requires for disclosure. I made a comment earlier about formaldehyde being one of the major emitters at Aliso Canyon that I did not see on this slide there.
Thank you, Alexandra. Dr. Simon, do you want us to start answering first?
Sure, and I counted 4 questions here, but
Alexandra,
what's that? Stay on if I miss something. But first one, this selection process. I'm still exploring with County Council and our contracts and grants group, but my hope is that we will have external evaluators making the selection. And ideally, they would be SOC members, or at least some SOC members on that. I don't want this to be a public health selection process. So that's question 1. Question 2, related to the report from the California Council on Technology and Science and Technology. That was a great report. I would really recommend everybody who's interested to look at that report. It's on our website. And I have great respect for the researchers that did that report. And they did cite some limitations. I mean, I don't think they discredited all the testing that was done. And I do want to say I have much respect also for the experts at CARB and South Coast Air Quality Management District in terms of their knowledge of air testing. But I think the authors of that report did point out some very significant limitations. For example, the detection limits for some of the testing were far too high. And so there may have been specimens that were excluded because it was a no detect, but nonetheless, the concentration might have been high enough to, be relevant for a health study. So, I do think we'll take the information that we have, but if there are ways we can use other experts to extrapolate, we can't go back in time and remeasure, but if there are ways we can take the existing information and use it more effectively, we will. But it is a lesson learned, I think, in terms of how testing is done in the future. Regarding the cancer registry, it is the best source of data on cancer diagnoses in the county. It goes back to the 1970s. We are fortunate in LA County to have one of the best cancer registries around. It's operated by USC. There are some limitations with the data, and there is a group from the community advisory, some folks from the community advisory group that have been working with the registry on a cancer analysis, data analysis. But we've all learned that it's not a perfect data source. For example, that the statistics are based on where someone lives at the time they were diagnosed with cancer. It doesn't necessarily then reflect where they lived when they maybe had exposures in the past that contributed to their cancer. So that's a limitation. And then lastly, the disclosure of the chemicals. I think we've already talked about that, but I will say we are talking to County Council and the board offices on looking at all options to get the most complete information we can.
Thank you. And Alexandra, if you could remember to lower your hand, that would be great. Next question is from Helen, and Helen will unmute you so you can ask your question.
Hello, I have a few questions. One is that it's been nearly 5 years and still Department of Health doesn't have any radius of, what's the radius that people have been affected by the blowout. It's been 5 years and you still don't have that. That's appalling. According to one of the apps that Andrew Crown had made, EHT, it showed 16 miles as crow flies. And Dr. Simon, when you say county legal, that really scares me. If they're the ones who are going to be deciding, because they're MIA, they never come to the meetings, and we don't know how they're thinking, they're reasoning, and with the subpoena, they have proven to us that they're not with us, they're against us. And also, it's been 19 months that you guys have had, the health department, county has had the money from SoCal Gas for this study. What have you guys been doing? I know you have had meetings, I know you have been talking, but have you even done a basic $10 CBC blood work to have a baseline? I mean, it's going to be into 7th year when you guys are going to start some kind of a study, which I don't even know how valid that's going to be after 7 years.
15 seconds left, Helen, just to...
Okay, but I also want to know how much of the money have you spent exactly on what and how much we have left? Thank you.
Okay.
Helen. Thank you for your comments and your questions. And there's a lot packed in there too, Dr. Simon. I'm not sure if how you want to tackle it.
Sure, I can start with the first question was about the radius, and so there, it's not that there's any single right answer. We're very aware of the symptom screening and tracking that was done by Mr. Crown, and in addition, other data sources that suggest that for some exposures, so for example, for the smells, the radius goes way out, miles. But for other exposures to certain chemicals, the radius may be much smaller in terms of significant exposures. And so we don't want to make that decision. Our department doesn't want to make that decision. We feel like it's important for the Scientific Oversight Committee and the researchers that provide proposals to make their best case for what the best radius should be. I will say that the smaller the radius, the closer you stay in your study population, the higher the likelihood that you're going to find something, because the exposure levels will be higher. The further out you go, you sort of dilute the effect, and so you may not necessarily find an association or anything implicating a cause. But at the same time, that there's a trade-off. I think if you only include those living closest, you're not really being inclusive and allowing many people who were impacted to be included in the study. So defining the radius is not straightforward, and there may be multiple radiuses depending upon what the exposures are you're looking at or the health outcomes. You mentioned your concern about the legal, and they're having a say in how we move forward with evaluating the projects. I will say, in my experience, I know many of you will strenuously disagree, but in my experience, they do want this to be a productive study, and I feel confident that that they'll be reasonable in advising us on what flexibility we have in terms of who evaluates the proposals. We have plenty of examples of other solicitations we've done where we've brought in external evaluators. So I don't anticipate that there's going to be a problem. The one issue, though, that's a little tricky is I would like to have some SOC members as evaluators, but the SOC members are also going to be involved in developing the solicitation document. And there's still a little bit of a question about whether someone who develops the solicitation document can also be an evaluator. But I'm hopeful that indeed it will be allowable for a SOC member to do both. So let's see. You mentioned what we've done over the last 19 months. We always want things to move more quickly. I think one of the biggest challenges for me when I moved from being a pediatrician into public health was the pace at which things happen. As a clinician, I was able to, I'm working with a patient or a family, I could make things happen quickly. When you're working in public health, things do move much more slowly because you're working in groups and you're working often in partnership with community. In this case, we started from scratch and we established a community advisory group. That took time. There was some debate and I think some unhappiness about that process. I acknowledge that, but it did take time. And then we've had regular meetings with the CAG members and multiple issues have arisen, just operational process oriented. And then in addition, events happening, for example, the Saddle Ridge fire that then sidetracked us for quite some time in terms of trying to, figure out how we best respond to that and address the questions that were coming from the community. Then COVID hit, not to make an excuse, but it's just a reality that slowed us up as well. The process of establishing a scientific oversight committee, that took time. And I'm really proud and excited about the group that we've brought together. I want to give a lot of credit to the community advisory group on this. They identified some outstanding independent experts that are now on the SOC. The money, exactly how much money has been spent? I don't have that answer tonight, but we understand that's important, and we will provide documentation of that in some public way. It may be on our website, but I will say that engaging the community in planning for a study, that takes time and resources. The public health staff that are involved, Dr. Davis, myself, other DPH staff, we are not taking any funding for our time. It's in-kind support, but we do have a consultant, Katz and Associates, that's on board. They're getting paid for their work. As I think it was mentioned recently, just in the last week, a community survey was done. This was done at the recommendation of some CAG members, and again, I give them credit. I think it was a good move, but it did cost some funding, cost some money to do it. So there have been costs, but our hope is to reserve as much of the funding as possible for the actual research that's going to be done, and we'll be providing the information, I think, shortly in terms of what the budget looks like. I think that
if I can add to that, it's not our hope. We will reserve the money for the study. There is some work that has to be done moving forward just to get everything in place. But I also want to acknowledge, you mentioned being afraid that legal was involved, but I also want to point out that when you talk about subpoenas, those are legal processes. So it's not as if it just happens as an independent and the court's not involved. And so we do have to have counsel involved on legal matters. And so that's the reason for their involvement in general, just thinking about what the strategy is, what legally can be done. But I also want to point out that even for the Public Utilities Commission, there has been some trouble and complaints in terms of getting the information. They are the regulatory body. So none of this is a very straightforward, public health just has to ask and we get it. There have been legal things that have been, put in place or legal impediments that have been put in place in order for us to get that information. Like it's private information or I can't remember what they call it. Something that wouldn't be disclosed. So thank you for that question.
Great, thank you. Just as a reminder, we have over 100 people on in the meeting. So just a reminder of how to ask your question. You can email it. You can go through the 1-800 number or the 1844 number and press 1 and 0. Type into the chat and raise your hand. We're going to try to, as easily as possible, go between these different forums and mechanisms. And on that note, I'm going to ask a couple of the questions that came via email. And one, the first one is stated, for the actual health research, how many subjects, how long, what methods will you be using? I took a hair sample from my daughter in 2017 that never got sent to the lab. Would that still be beneficial for your study?
That's an interesting question. Yeah, I think those specifics will be defined by the Scientific Oversight Committee. Again, those are decisions we want the experts to make. The value of biological samples, blood, urine, hair, nails. Again, those are highly technical areas. I don't feel qualified to answer the question. But I will say that we will, I'm assuming the Scientific Oversight Committee will be considering, testing of biological samples. And so while I can't, give you a definitive answer regarding I think you said it was your daughter's hair sample, our hope is that if you're interested, you or your family members will have an opportunity to participate in the study.
Yeah, I will add, I think, what researchers, will propose in terms of the questions they want to answer and the methods that they'll use are really determined by them in terms of the research that they're going to do. So at this point, we don't have clear insight as to what everything might be. We might have some ideas once the goals are identified and the SOC does that, but it's really the researchers in terms of what methods they will need to use in order to answer the question in terms of their proposal, for the research and the study. But I do want to highlight, this is really why, and even with information missing, it was pointed out earlier by one of our callers, that really this is the reason for doing a long-term health study. The people involved, the symptoms they had, the timing of the symptoms they had, where they lived, and then any additional information that is known about the chemicals that were involved and the potential amount of exposure that a person had is really what helps to answer, what the questions about what are the short and the long-term health impacts of this disaster. So we really do need people to participate, and more details will come as the researchers submit their proposals and they're selected.
Thank you. And another question that was emailed: what will be done with the results of the study? Will treatment or care be provided, and what will be the follow-up?
It's a good question. In terms of this, the settlement itself, it put in funding for the study itself. There were some other things that were related to, air quality monitoring in terms of the breathmobiles, and other things that were funded to do air quality monitoring, but nothing in the settlement itself that I recall had anything related to treatment. So I don't actually know what the outcome will be of that. I do know that based on what we understand, it could lead to and inform changes in policy that might prevent future episodes like this, or even improve the environment where people are living at the moment. So remains to be seen. The results definitely will be out there for the public and for policymakers to view, and hopefully there are recommendations that can be gleaned from that in terms of preventing this or addressing the issues that are noted from the studies themselves.
Thank you. We're going to go back to the hand raise questions for a moment. And first up will be Ignacio, and we'll start the clock after you're muted and unmuted and begin your question.
Yes. I had a quick question for you. We just moved here to Granada Hills, and I wanted to just understand it. Is there like a website, or is there something that tracks if there's any other leaks going on, any information that we know of? Just wondering, because there's been some work being done on Cessna Boulevard right now because there's a gas pipe leaking currently that they're kind of been working on for a couple of weeks now. So just wondering what's proactively being done to communicate to the community of any potential leaks that are taking place.
Thank you for that question. Dr. Simon, do you want to take that first?
Yeah, I wish some of our staff were on that could answer that very specifically, and I think we need a mechanism to provide answers that for folks after the session tonight. If we can give information about where people can go to get questions answered. My understanding is that first of all, I think that there is active monitoring at the facility. And that information, gets reported, I think, to AQMD along with CARB. But in addition, I think AQMD does respond to odor complaints. But I'm not sure if there is actual data out there on, what may be happening in terms of, emissions on a project working on a street. You described something going on a street, and I'm just not sure where you would go to get more information about that. But I know there are places you can go, and I think Susan and staff, if we can make sure to have on our website after this session tonight information on that, that would be helpful.
Definitely. All of the questions that are being asked will be transcribed and posted on the website along with answers. And so if we don't have full complete answers this evening, we can add those to the website. So Dr. Davis, did you have anything you wanted to add to that one?
No, thank you.
The next speaker will be KB, and we'll unmute you and start the 90-second clock.
Hi. Hello, Dr. Davis and Dr. Simon. So a couple of comments on what you said. So first of all, the public was not given proper notice for this kind of disaster. Personally, there should have been a reverse 911 that went out to the public immediately, so they were notified. From what I understand, the people were notified by mail 3 days later, and they were forced to sit in that toxic gas, which was completely unacceptable. Saying that we're not going to be doing this health study for another year, as Helen points out, that's ridiculous to me. I was handed a list of 44 contaminants in our house: phenol, methane, acetone, formaldehyde. These are acrolein, xylene. These are cancer-causing chemicals. You guys know it because you handed this to me. You can now immediately put into a system of medical monitoring to say, hey, these are the things you were exposed to. These are cancer causing. People are contacting me about their cancers. That's unacceptable as a public agency. You guys know that. You have to have some sort of accountability. You can't wait a year. It's completely not okay. It's not okay that SoCalGas is not disclosing the full list of chemicals because they know that it's not 100% methane. They know that it's leaking out of fissures in the ground. As you could see in the Saddle Ridge fire, and we had ghost fires, and down at Walmart, where there was fire coming out of the parking lot that people photographed. You have to now help people. You have to tell them, I have witnessed the cancer. I have cleaned blood up off the floor. I have been in the emergency room. My boots are on the ground. And now when you're talking about Playa del Rey or that area or wherever it is, this is unacceptable, you guys.
Thank you very much. We'll let Dr. Davis and Dr. Simon address your comments and questions. Thank you.
Kelly, you and I have talked before, if I remember correctly. And I've heard your story, and again, understand and hear what you're saying in terms of that. We are moving forward with, again, trying to do this in a scientific way. It's not something that a health department normally does in terms of a health research study. And so we are getting the experts that can do that. And as Dr. Simon mentioned, we are moving forward with working with the Cancer Registry, who does do the analysis to understand where there are cancer clusters, and that's their role in terms of assessing the health of the community and identifying locations where there is an increased rate of cancers. So we're moving forward with that in that regard. And as I said before, communication is always an issue, during a response. And I've noted some of the issues that were identified. I think the reverse 911 system is a great system that could be used moving forward. And there are a lot of additional response agencies. And so we will follow up on that in terms of the county and city responses, just in terms of are those things in place. But I think you make a great suggestion in terms of that around communication. And we're doing, the things that we, think are needed in terms of making sure that this is a validated and good study that we can rely on the results. But I hear you. This has not moved as fast as it could have moved potentially. But again, we're going through and making sure this is independent in terms of having the scientists from outside, making sure that the experts who are advising, scoping this study and coming up with study goals are outside experts as well. And unfortunately, that typically takes time in terms of doing a health study. But I appreciate it, and I thank you for your comment. And we'll keep everyone informed as things move forward.
Thank you. Our next question will come from Deirdre. And Deirdre will unmute you so you can ask your question.
Okay. All right. Can you hear me?
We can hear you.
Okay. Hi. Yes. All right. Thank you for taking my call. We are coming up on the 5th anniversary of the Aliso Canyon blowout, and I'm very happy to hear you do not want DPH to pick the research group. I agree with you. This is the only way we're going to have an objective and a non-biased study. So also, that was a comment, just I agree with you. Also, when the next blowout comes, because it will, and we know, as per your last caller, she described exactly how you guys took care of it, and it was really shocking to all of us. So do you have a plan in place, or are you currently making one? That reverse 911 would have been real nice too. Are you going to send letters like you did last time, citing the SoCal Gas, saying it's safe and no harm has come to your community? Because really, that's a really big concern of mine, that we're going to have a repeat and you guys are not going to be there. So what do you, okay, because you guys sent out notices to me. I got them in the email for the fires. Close your windows, stay inside, don't exercise, bring your animals in. We got nothing like that during the blowout, and I want that. I need that. I'm a resident here. I want to be protected, and I need you guys to do what you do for other communities. I read that you guys had air and blood testing vehicle go to other places that have had leaking, and we never got that, and we got the letter from Rankin. So please, I'm new here and I'm nervous. We need a plan in place, and could you please publish it so we can see it?
Thank you very much. Dr. Davis or Simon?
Yeah, no, yes. I hear and I hear the suffering from what happened in the past and the worry and the concern about what might happen in the future. We are, again, not the only agency that responds in terms of these disasters, or this type of disaster. I think we do need to look and see exactly what has been put in place in terms of a reverse 911 system or not. It's not been a question that has come up or that I've asked in that regard. The staff may know who are not on this call and not speaking. But I hear you and all of the callers in terms of the suffering that has happened after this. I also do acknowledge that, in this, if things were different in terms of response being faster, the communication being better, and in a more precise and quicker way than a letter, that may have changed things. I also understand, again, the letter that was just mentioned, related to the health alert that went out, didn't communicate in the way that I think it was intended to communicate. That unfortunately can't change at the moment, but learn from that in terms of trying to move forward. I do think and recognize that many of the agencies that were responding, all recognize that there are things that could have been done differently in this, and have worked to utilize a lot of those things in terms of moving forward, even for some other smaller incidents. But unfortunately, it didn't happen, during the time of the Aliso Canyon blowout. And had things been differently, things might be differently now. But I will say that that disaster is something that would be difficult to control. But it could have helped if communication, were better during that time. I think we were all acknowledging that and hearing that from you as well. And we'll move forward in terms of trying to work with our partners. I don't know if there's a plan that all of them have written together, after that incident, but we will definitely follow up and ask that question. I will personally to find out, what has happened in terms of moving forward. But again, I'm sorry that I can't answer a lot of your questions in terms of why certain things were done. I do know that the staff did the best that they could, and information is always evolving in an emergency, and sometimes that makes it difficult. Sometimes we can't respond if we're not quite sure what it is, and we want to confirm that, and sometimes that slows down information, but we try to put out the most accurate information that we can. But in either case, again, I hear everyone in terms of the suffering. I hear the frustration and I hear the anger. And we hopefully moving forward will not have the same type of incident, first off, and that our response in general as a larger county body and city and agencies that are responding to this, will be better. Again, each time we have an emergency, we learn from them. And we try to put things in place in order to make the response different. But I hear you, and we will determine and make sure that some of the things that we saw before are better than what they were at that time. We will still be always at the expense of trying to figure out if we have the accurate information, if we can get the most accurate information. That's always something that happens during emergencies, and even day to day, sometimes some information is missing. But we continue to work forward to try to get the information that is missing, and we are committed to having the study, be successful, be validated, and be trusted in terms of the findings that it has, which is why it takes some time to put these things together. Again, I appreciate you and understand and hear everybody's frustration.
Thank you. We're going to move over to the AT&T moderator. There's a caller or two with a question there.
Thank you. And we are now going to the line of 33. Line 33, your line is open.
Yes, one moment.
Again, if you have your computer on and the call, you might want to mute the sound on your computer so we don't have an echo.
Yes, regarding the Aliso Canyon gas storage facility contaminated groundwater and the poisoned aquifer, what has the county public health done to sample the source of contamination upon the neighborhoods? What testing of the groundwater under the neighborhoods has the storage facility has public health relied upon in order to gather information of the chemical and radiological makeup of the contamination, which continues to poison the community? Public health does not interface with Cal EPA or federal EPA on this whole contamination and continuation of contamination problem, whereby groundwater monitoring wells must be installed along the fence line and beyond site boundaries down gradient of the gas storage facility. A plume of hexavalent chromium now grows under the community, yet not one monitoring well exist to map the extent of this poisonous cancer-causing substance, chromium-6. No remediation efforts are underway. Plumes of radioactive substances are also growing. Plumes of toxic substances are making their way under places we call home. Meanwhile, the neighbors are inundated by cancer-causing vapor intrusion into their homes and businesses that emit up into places people frequent from poisoned groundwater under their feet. Similarly, public health from the county has not routinely been monitoring the toxic surface water runoff from the gas storage facility, and not one NPDES outfall has been installed to capture and treat surface water poisons flowing off of SoCalGas property and into public parks and backyards where children play. Soils similarly have not been sampled for toxic substances independently and not by Geosyntec, the hired gun of SoCalGas. The area around and below Aliso Canyon Gas Storage Facility is replete with toxic contamination. SoCalGas self-reporting of such contamination is akin to the fox guarding the henhouse mentality. Only independent testing is to be trusted and accepted by the community. Public health must stop kowtowing to the polluter and the polluter's enablers here. Public health must begin informing the citizenry of all poisons we are being exposed to by the polluter, SoCalGas.
Thank you very much for your questions. I'll turn it over to Dr. Simon.
Sampling using LICOR drive-by of the facility and drive-throughs around the facility has stopped despite massive findings of continuous leaks through area soils from the toxic materials that lurk beneath and below our feet. What has public health done to reinstate daily and hourly LICOR?
I don't want to cut you off, but I also want to make sure we have time for many other callers who are waiting as well. So I'll ask Dr. Simon to respond to some of your concerns. Thank you.
Well, there were a lot of really important issues raised in those comments and the questions. The integrity of our groundwater is an issue across the county, and again, we're not the agency that monitors or regulates that, and frankly, I don't have the expertise to be able to answer some of your questions on that. But I will ask staff to respond to what we know about how the Aliso Canyon gas facility may be impacting aquifers and other underground or surface water systems. In the documents that I've read, particularly again that California Council on Science and Technology report, they talked about local groundwater sources being threatened, but they did not talk about contamination. So if what you say is true, I guess I want to know that, and I'm going to ask our staff to summarize what they know, and then if there are documents that you have, we're happy to look at those and take that into consideration. Thank you.
Thank you.
I do want to add, at least in terms of that question, it's a good question and it can be put forward, and the Scientific Oversight Committee can consider it. The Water Board does have the authority. They could be involved in the study in some way, or questions related to data that they would have gathered as well in terms of the water quality. And so we can, Dr. Simon, I would say, the question about water sampling, we can take back, to the Scientific Oversight Committee, who are probably already thinking about that as well. But a good point that you brought up, and we can definitely, again, have the Water Board, who is the authority, be involved if necessary.
Thank you. We're going to move back over to some hands that are raised in the WebEx call. I'm going to give you the lineup here so you can, those who are in the queue know they're next. First, we're going to go to Jane, then Sherry, then Craig. So Jane, will unmute you and start your clock.
Hi. Can you hear me?
We can hear you.
Okay, sorry. Thank you. I do want to say thank you. You're hearing our frustration and a bit of rage over all of this. And I'm just glad to hear you acknowledge that, because, it's upturned many of our lives. I was involved in trying to get the health study for years. We had meetings with Department of Public Health, you guys. And for me, here we are, right? We're finally doing this health study. However, I must move. I cannot live here any longer because it affects me. I can't take it anymore. So as soon as COVID is over, I am moving. But my question is, will I still be able to be involved in the health study?
Any question, Jean? Dr. Davis?
Dr. Simon, did you?
Sure. Well, let me just say that's heartbreaking to hear. I'm so sorry about your suffering. No one should feel as if they have to move for that reason. The answer is yes, possibly. Again, it's going to depend on the Scientific Oversight Committee and I think the research group. But I think good arguments could be made for the need to include those who lived in the community and who've moved away. The question is, how do we best do that? This is, I think, where the time that has elapsed does work against us. It makes it more challenging because with each passing year, there are more new people that move in, but then many people who move out. And so that creates a challenge, but I think that'll definitely be a consideration and I hope a priority for the SOC and the research group to consider people who moved out of the area since the blowout. But I don't want to speak for, I'm only one of 14, hopefully 15 people on the SOC, so I can't speak for that group.
I will say that it also depends on what they need to do in terms of what information they need to collect in order, the researchers, in terms of to do their analysis. There's a possibility that it's just health data and maybe stuff by phone that could be done if you were remote. And I think we have to figure out if that is a possibility, how we sort of keep track of people who may have moved out, or you keeping up to date on what's happening on the website, so that if there are others who have moved, unfortunately, for this particular reason, that they can, put their names in there to take part in the research. Paul and team, I do want to make sure that as we move forward, if those are possibilities, that we have something readily available on the website so that people know that how they can get involved with the most current information in terms of taking part in whatever study they may be eligible for.
Thank you. And just a reminder, after your question has been answered, if you could click on your hand just to lower your hand so we know that you're not asking to ask another question. Next up will be Cherry. We'll unmute you so you can ask your question.
Okay, can you hear me?
Yes, we can.
Okay, my name is Sherry Darahoney and I lived in Porter Ranch for 15 years. I was on the neighborhood council. It was discovered. Within 10 days, we had a community meeting. One of Jimmy Cho, the SoCal Gas Chief of Operations, I had a question and it hasn't been answered in 5 years. With all the agencies, such as the governor's office, who appoints Dogger and the new name for that agency, and public health, and all these different AQMD, CARB, all these things, is there one or two liaisons who coordinate the various government agencies so that they can work in tandem? Every time I come on a meeting, I don't know how many times I hear you folks say, well, I don't know that, that's beyond the scope of our this or that. I know there's like 1,200 facets to a magnitude Aliso Canyon gas leak catastrophe, but it's almost 5 years and still the county, the city, the state, and all the agencies in between don't know what the other ones are doing. And I agree with every person on this call who has said 5 years is too long, 1 year is too long, 6 months is too long. I met with Gavin Newsom when he was lieutenant governor. Only 2 months after they sealed the gas leak, I happened to be at a symposium for solar power. I asked him the same question. Why don't you have a liaison or a couple of liaisons that can coordinate all these government agencies and make it run smoothly? I want the answer. Thank you.
Thank you very much.
Thank you. And actually, in truth, we do work together. We have worked together in terms of the response. I think the question about the groundwater is not something that I know off the top of my head in terms of what they are doing or what they've done. So I can't answer that question just because I don't have at the moment intimate knowledge of that. But we do, and we have worked with across multiple agencies, including with the ground fire. We did that as well, and even during the incident. I think there is always the complication of even inside of a business. Sometimes everybody doesn't know what everybody is doing at the moment, but we do work together when we have things that cut across, and we do get information from others and work with them to try to figure out what's going on in terms of response. I do want to acknowledge that I know some of you have said that my mic is muffled, and I've heard from others that it's clear. I'm going to turn my camera off after this next question and try to figure out if I can change something. But to answer your question, we do work together, but maybe it's not day in and day out in terms of the day-to-day work. But when we have the need to, we do liaison and work with others.
Thank you. And next up is Craig. And Craig, you'll be followed by Rose. And Craig will unmute you so you can ask your question.
Thank you, Susan. And this is Craig Galanti for all those on the call. I am a CAG member, so thank you, Dr. Davis and Dr. Simon, for being here tonight. You're hearing from the community, and I encourage as many that haven't said anything to make sure you get your voices heard. It is a virtue of success in business and in life is begin with the end in mind. So I would like to ask the doctors, as representatives of DPH, if you will make public a comment in support of what the CAG has been advocating for what would be a successful health study. And we have shared this with you many times. There's 3 pillars: that the health study be science-based, community-centric, and absent any political influences or agenda. I'm going to ask you to commit to those 3 pillars. And then I also want to ask you, how will you evaluate success of the health studies? If, again, begin with the end in mind. If you do not have proper evaluation of how this study is going to be conducted and fill the needs of the community, you're not going to be successful. So what is the plan for that? And then after that, I do have one follow-up question. Thank you.
Right.
So, Greg, I appreciate the question. I appreciate the work. I also think that that we have been, working towards having this be a science-based study. We've started out, getting input and hearing input from the community. We've taken the CAG's input in terms of the SOC and added independent members. We also, have this forum to try to get, more input from people, and we'll have, the community's feedback on the goals of the study goals in terms of the research studies or the proposals that, will be solicited. We have been, keeping ourselves as much as possible, out of that decision making. In terms of political influence, research is research. The researchers are independent. They're going to write up their reports and their studies, and the SOC will look at those and evaluate as they're going along in that process. So, our commitment is to have it be science-based, to have it, answer as many questions as we can, as the researchers can do in terms of the research, the questions that the community has. And I have no political agendas in terms of this. I think we want to understand what really happened so that we can better have either policies or systems or response systems in place to better be able to respond to anything like this in the future, and hopefully to prevent it. I don't think any of us want to have to see anything like this happen to any community, across this nation or this world. So I think that we've committed that, and if you're asking us to say that publicly, we are, and we have, and we've been working in that direction.
So we have about 10 minutes left. Do you want to, Craig, I know you had a second part to your question. I was I'm hopeful that maybe you might let us get to Rose and Save Porter Ranch, and maybe if we can come back to the second half of your question. Is that okay? If you could unmute Craig. I'm sorry, I didn't hear your response.
Oh, I was muted. My follow-up question is a direct response to Dr. Davis's comments. Thank you. And if you would please come back to me, I would appreciate it.
Thank you. And so I'd like to recognize Rose. Rose will unmute you. And if you could ask your question, we'll stick to our 90 seconds.
Can you hear me okay?
Yes.
Okay, it's a quick question. Well, it's not a quick question. I was exposed for quite a while. My family had all the symptoms: bloody noses, headaches, stomach cramps. My daughter had atypical acting out behavioral issues. I tried to explain to my pediatrician. I thought it was from exposure. There was absolutely no evidence that it came from that. I recently, within the last year, was diagnosed with cancer and have been fighting it for the last year. I told my oncologist, once again, I don't have a history of cancer in my family. I'm young for having cancer, and once again, told my oncologist that I was exposed to it. He said he could not rule it out, but there's no way for him to know one way or another. Is there some sort of information that I can give to my pediatrician and my oncologist so that they can understand that we're not crazy, that we think that this is a direct link to our health issues?
Thank you, Rose.
Rose, I'm sorry to hear that, in terms of both your child and you. Dr. Simon, I don't know if you have a thought in relationship to that. I know we talked a little bit about the study, but is there anything, I think the difficulty in terms of trying to identify exactly what caused the cancer is always difficulty. But I think this is one of the reasons why a health study with more people with similar experiences helps to provide more information and evidence as to a possible link as the potential causes. Dr. Simon, did you have anything to add to that?
Well, I just want to share my, expression of sorrow that you're suffering in that way, and your child as well. Unfortunately, there are no easy answers. I mean, when anybody gets sick, they often want to know why, and very frustratingly in medicine, we don't always have those answers. But I would never say you're crazy. I mean, you all have very justifiable reasons for your concerns and for your anger and for your questions. I hope again we can produce a really high quality health study that will help provide insights. It's not going to answer everybody's questions. I don't want to falsely elevate expectations, but we do hope that will help answer at least some questions and provide insights.
I would say though, maybe if your pediatrician is willing to talk to one of us here, maybe that's something that might be helpful. I don't know that we have anything in particular that we can give you in relationship to that other than the information that's already available. But maybe that would be, one option. Our staff, could, provide some additional information or insights if that would be helpful.
So we have two more questions or hands raised that we haven't heard from yet. Save Porter Ranch and then Patty. We want to hear from both of those questions, and then we'll try to start to wrap up a little bit. Ranch, you're up first.
Can you hear me?
Yes.
Hey, this is Matt Pacuco, president and co-founder of Save Porter Ranch and unlucky 13-year resident of Porter Ranch. So, knowing all that you know now about the local health crisis and the history of that facility pre and post blowout, can the county health department state that it is safe for people to live so close to the Aliso Canyon facility versus all else being equal if there was no such facility next to them? And I'm referring to potential contamination and emissions from the facility and residual contamination in the area. And depending on your answer, I may have a follow-up question for my remaining time.
Thank you.
Dr. Simon, can you touch upon just in terms of what we know in terms of, being next to industrial facilities in terms of health?
Yeah, I mean, it's a tough question, safe or not safe. It's not an either or. There are gradations of safety or risk. I frankly worry a lot about communities within close proximity to any underground natural gas facility because of the risk of catastrophic events. The blowout one, but fire, an explosion, a terrible earthquake, particularly in a facility where there's aging infrastructure, that worries me. The questions about chemicals, I think, is more uncertain, to be honest. I just don't know. I would never say it's safe, 100% safe. And sadly, I think there are many communities that sort of face that same circumstance, that they're not necessarily living in as safe of environments as we would like. I think that's sort of the best I can do in terms of trying to, answer that very direct question.
Did you want to use the remaining time to ask a follow-up question? That was directed to Save Porter Ranch. Are they muted?
Oh, no, that's it. Thank you.
Okay, thank you very much. And our final live question will be from Patty. Patty will unmute you and you can ask your question.
Can you hear me?
Yes, we can hear you.
Okay, thanks. Thank you for the nice words about the CAG. We've been really working our tail off, many meetings and a lot of emails. But this is regarding kind of based on what Matt said about the safety. Every time there's a fire or a leak or some sort of incident at the site, SoCal Gas issues a statement saying that there's no long-term harm to the community. And I know that my fellow residents are very ticked off about that. So is there any way that the Department of Public Health can issue a statement to the gas company publicly to say, knock it off, you have no way of knowing this, and that's why we're doing this, why the study is being conducted, because it would really help to some of the healing for this community. Thank you.
Thank you, Patty.
Thank you, Patty. And it's a good idea. I mean, I think we should, and this is, I can talk to the team just in terms of trying to get SoCal Gas to maybe improve upon the messaging that they're putting out there. We don't have the ability to stop or change it, so we can see what we can do to try to influence that. But I hear you, and it probably feels like, just given everything else that's happened, that it's not the best thing to say in that moment. And you're right, you don't always know what may come. They don't know everybody's individual potential exposure if there were things. I do think that it will be important as things move forward to ensure that the air monitoring is up, although I know it's not always perfect, just in terms of everything being monitored, but that is something that could be helpful. But I think in general, I hear you on the comments related to SoCal Gas and their communication. We're happy to see what we can do related to that.
Thank you. And I know that we were not able to, or we did not focus on reading a lot of the chat questions because we wanted to recognize as many live callers as we could. I know there are a couple folks that still had their hand up to ask a second question. If you could type your question into the chat, that would be great, because we are keeping track of all of the great questions and comments that were noted in the chat, and those will all be part of the record of this meeting. And those questions and comments will be addressed in the posting that goes on the website. So there were some questions about chemical lists. There were questions about SoCal Gas involvement. There were questions about other agencies as well. And so there's lots of great questions in there, and those will all be posted again onto the website along with answers to those questions. Reminder that you can still submit additional questions via email when the meeting ends. So we welcome you to do that as well. And to please double check or check the public health website for responses and for a summary and recording of this meeting along with the slides that will be shared there as well. The survey that we noted in the beginning, how to get involved, stay involved, that survey link will be live until October 11th. So we strongly encourage you to take advantage and to provide input there, along with following the study in terms of newsletters and providing feedback in the log and looking at all the symptoms and different information that have come from the community thus far in that bottom corner box there as well. So I'd just like to thank you all for your time, and I'll turn it over to Dr. Simon to make some closing comments.
Well, let me just say, can you hear me? Okay, I heard a little bit of an echo. Let me just say, I've actually spent an awful lot of time the last year and a half with particularly the community advisory group members, and have had a number of opportunities to talk with folks in the community. I feel your pain. I obviously can't say that I experienced it the way you did, but I feel your pain and your frustration. I've felt incredible frustration when I've not been able to deliver on all the things that you've wanted. Please know that I and the team here are working as hard as we can. We are on your side. We want a good health study that answers as many of the questions as possible. I want to just echo what Dr. Davis said and really thank the CAG members. The incredible amount of time and their commitment to this is amazing. And to many of you who I've heard from repeatedly, I know you're equally committed, and we'll do our best to to meet your expectations as best we can. Thank you.
Dr. Davis, would you like to make any closing comments? You're muted.
Sorry about that. Just as Dr. Simon said, I really do want to thank all of you for participating. Appreciate the questions. They're hard questions. And again, we don't always have the answers on them, but we do hear them and we try to work towards getting answers or resolving whatever issue there is. And, again, I know that all of you have suffered, from this, have been suffering with this for some time. And each time we try to move forward, we're trying to move forward with your best interests in mind. And this study is really once in a lifetime. This is not usual to have money that has specifically been set aside. This is not something that we could have done as a public health department on our own, given our limited and already assigned budget. But $25 million for a health study, we want to make the most of it, and we hope that all of you will help us do that and participate, where you can, where you're eligible, in terms of whatever study and research is done as we continue to move forward. And so thank you for all of your questions, your comments, and please understand that our hearts are with you, and we're working towards your benefit again. And thank you again to our Aliso Canyon Disaster Health Research Study Team, again, who made today possible. I'd like to express my gratitude to the steering committee, as well as the commitment demonstrated by the Community Advisory Group and the Scientific Oversight Committee that we've done thus far. Again, a health study is really a shared responsibility. We can do what we can on our end. It does require all of you to participate, and I'm excited, to come together and work with all of you and the researchers, the SOC, and all involved, to make this successful, science-based, community-centric, and free of political agendas. And we look forward to the continued collaboration. I know we sometimes have some tough conversations, but that's the nature of collaboration. Again, we are committed to working with you, and we encourage everyone to visit our website, where we post updates related to the study, and also to learn more about where the study is in terms of the research. And then once the study is going through and progressing, we'll provide updates there as well. So again, I want to thank all of you, and I hope everyone has a safe and wonderful night. Thank you.
Thank you, everybody, and have a great evening.